So right now, the current residency I'm in, we rotate in a bunch of different settings. So we have pain management and palliative care. And palliative care is a little bit different than pain management. Palliative care, you've ever heard of hospice before, and palliative care is kind of thrown into that same hat. Not exactly the same, but palliative care is a lot of symptom management, and pain is involved in palliative care, but you're going to deal with a lot of different things, whether it's nausea, vomiting, depression, symptom management. So like a lot of patients are on different tube feeds and have problems like eating different things. So you have to think about those kind of different aspects. But to go back to your question, we have inpatient and outpatient treatment for these that come into us. And our inpatient we have an acute pain consult service that I'm a part of with a nurse practitioner and anesthesiology team. And we also have couple different rotations. It's surgery trauma. So a lot of patients that come in for traumas, we're treating them acutely for a lot of their injuries, a lot of resuscitation for a lot of patients. And also in the acute setting, I do rotate for oncology and psychiatry too. So that's a different aspect completely. But on the outside, we see a lot of more patients for chronic pain management. So I'm involved in a couple different clinics, whether it's just chronic pain with patients. And sometimes we also treat a lot of sickle cell patients that have chronic pain. So sickle cell is really, really prevalent down south in the African-American population. It's a lot that we see, especially in the Jacksonville and even Miami, where I'm going to be going. It's very prevalent in those areas. So a lot of these patients come in with extreme pain crises from sickle cell. So their blood cells, their red blood cells sickle, causing vaso-occlusion in different parts of their bodies. So a lot of times they're coming in with extreme pain, and once again, it's a stigmatized population. So, but we are treating them in our outpatient clinics, trying to reduce the amount of hospitalizations they're having. And we also treat patients in our palliative care clinic too on the outpatient side. So that is an excellent clinic too. So a lot of those chronic pain patients are seen in those clinics. But I would say our residency as a whole, it's very strong because we have a mixture of inpatient and outpatient pain management, and palliative care too is very, very diverse and mixed into the inpatient side of our program. So it's kind of the best of both worlds. So I felt comfortable going into the job market, like not feeling strapped down to tied down to one thing exactly.